Hello, my name is Dr. Srikanth V. This is a question which is very common for most people, whether gynecomastia surgery is painful. The answer is a resolute no. Surgery is not painful. It will be done under general anesthesia so that you are not awake throughout the procedure. When you awake, you will be in the post-operative recovery. You will not notice anything about the surgery. Also, today a lot of techniques have advanced with the anesthesia, and if your anesthetist is skilled enough, they can give you different kind of nerve blocks like erector spinae block with a drug which is long acting for 8 to 12 hours so that the nerves which carry pain are numb and you don't feel the pain in the post-operative period. Following 24 hours, most people pain is reduced. You can take a simple painkiller. The painkiller is something that suits you, which your plastic surgeon is familiar with, and simple medication, oral medication will be able to take care of pain. Few things that you can do is immediately after surgery is to do some basic stretching exercises, stretch the skin, don't let it get too stiff, and that will help in your recovery and in the post-operative pain. Now, one of the things about gynecomastia surgery is that a lot of them are amenable to liposuction. When you say liposuction, we suck out the fat from all the parts of the breast, but we don't cut any skin. So it is like a pillow where you remove the stuffing out and the pillow cover is still there. So it is still wrinkly and saggy. Now it will shrink. Nature will help it to shrink, and this will take some time, about 2 to 3 months. However, what we have seen with our experience and other patients' experiences over the years is that when they wear a compression vest, they feel more comfortable and the skin shrinkage is better. So yes, definitely you will be asked to wear a vest, and it is in your own interest that you wear a vest so that one, you have good pain relief, your mobility is better, and the skin shrinkage is more controlled and quicker. Now, as you all know, gynecomastia is a surgery done under general anesthesia. So there will be a recovery period. Now, the recovery period is usually about a week. So I would suggest avoid very vigorous activities for about a week or so. After that, depending on your soreness, your plastic surgeon will tell you to start stretching, moving, rolling your shoulders, and you can get back to your normal exercise routine in about 2 or sometimes 3 weeks. Generally, if you have a gland excision, the cut below the nipple, I think that you will take about 3 weeks to recover. If you had a simple liposuction alone, in which liposuction has removed the fat and the gland, and just there are 3-4 millimeter ports on you, you can get back to doing vigorous activity as early as 2 weeks. You can hit the gym, you can do push-ups, you can do running, you can swim, you can cycle. All of it definitely after 3 weeks. As you all know, gynecomastia is a surgery done under general anesthesia. Whenever we give anesthesia, to make surgery safe, there are a few restrictions. You will not be allowed to eat or drink anything for about 3 to 4 hours after surgery. Following surgery, you will be advised bed rest for a day so that you take things easy. You're not vigorous activity. You can use the toilet, come back, maybe at the most go to the dining table, have your food, come back, but spend the day in bed, rest so that you're comfortable even though you don't have any pain. After that, I will encourage everybody to get up, walk, move around, stretch their chest, stretch their arms, stretch their shoulders, which will start as early as day 1. You will be given a vest, compression garment, which you are expected to wear for about 3 months. Vigorous physical activity is avoided for about 2 weeks or so, and by end of 3 weeks, you are allowed to do anything vigorous like play, running, swimming, playing shuttle, tennis, all that. At the end of 3 weeks, you are back to your normal activity. One of the things that is done during surgery is the placement of drains. Now, what are these drains? Basically, they are tubes connected with negative suction to a small container. The container is a plastic or a silicone container, which with negative suction helps to suck out the fluid that is there in the body. Now, do you place drains in everybody? The answer is no. It is basically a surgeon's preference. Some surgeons prefer to keep drains, some surgeons prefer not to keep drains. I, as a preference as a surgeon, would like to keep drains because it gives an added layer of security to prevent against complications, and it is a simple matter. At 24 to 48 hours, we pull out the drains. It is not permanent, it is temporary, and it has a benefit of pulling out all the fluid which otherwise be collected within the cavity of the chest wall, and the body is expected to drain it out. However, when you have a drain is going to remove it and your recovery is a little better.